But there are 1 in 4 individuals that have challenges and have to learn how to live with mental illness. But I'd rather use the word challenge. You know, you asked me earlier, you know, if I would rename the label SMI. I would also use the word challenge or live with mental illness, live with mental health challenges. I think there's so many positive ways that we can put our point across. You know?
Yeah.
Who doesn't need support?
What is SMI?
SMI is a label that here in Arizona stands for serious mental illness. It labels, or it's a way to state that an individual has a mental illness, a serious mental illness like bipolar, major depression.
If you could rename the word SMI to stop the stigma,
I wouldn't create a label. Because to me, the stigma comes from having a label. If you didn't have a label, I don't believe stigma would be attached. You know, in the physical health world, you don't have a label. When people talk about your illness, you tend to hear, you know, Liz has a broken leg. Liz has heart problems. Liz is dealing with fill in the blank. There is not one overarching label that describes individuals that have a physical illness or challenge that they're dealing with. So I don't believe there should be a label. I think by having a label, you're causing stigma.
what obstacles still stand in our way despite more healthcare funding under the Affordable Act?
There's numerous obstacles. I believe the number one obstacle, though, is supply and demand. When you increase the demand, which the Affordable Act is meant to allow more people to have access to insurance, which means having access to medical services. Well, if you increase the number of individuals that are going to have access, do you have the supply, for instance, the doctors, the technicians? Do you have the supply or to meet that demand? I don't believe we do. So I believe that's a major obstacle.
Why should we be optimistic about the new integrated healthcare system, which puts the person first language, interaction with patients or consumers with dignity, not their diagnosis, compared to the old system?
By integrating both the physical health and the mental health, I think we can learn a lot by hearing a doctor or a nurse say, you know, Liz is coming in because she's dealing with some heart problems. You know, Liz is coming in because she possibly has a broken leg. You know, and maybe we can learn from that by saying Liz is coming in because she's hearing voices. Liz is coming in because she's depressed. I think we could learn a lot from that. Secondly, I feel that we're going to, by having an integrated health care, we can share one medical record. That will allow us not to have to repeat our stories over and over and over. Another plus is if I'm having side effects from my psychiatric medications, my PCP might be able to help me address that. Never know, you know. I have certain medications that might cause me to gain weight. My psychiatrist doesn't necessarily address obesity. But my physical health doctor, my PCP, most likely does address obesity. Those are just a couple of examples.
What are your thoughts on your own clinic, Recovery Innovations, releasing peer support specialists, coaches, and teachers who are veterans, persons with mental illness, the disabled, or who were once homeless back into the workforce, even if it means only part-time?
Oh, it's great. That is one of many reasons, but that is one of the reasons I chose to come to Recovery Innovations. Recovery Innovations, for years, have been doing that. It's nothing new. It might be new to a lot of providers. It might be new to some communities, but it's not new to Recovery Innovations. And so I say it's great. You know, I know there's concern sometimes. I hear out in the community, some individuals will say, well, I don't know if they can handle going to work. So maybe they need to go part-time. Or even part-time. People will say, I don't know if he or she can handle it. You know, that I think is very sad. Because I know a lot of people who are not in any of those categories that you just named. They've never been homeless. They're not veterans. They've never had a mental challenge. You know, they're not in any of those categories that you just named. Okay? But every one of them needs support. They all need support. Maybe it's being reminded to take vacation. Maybe it's being reminded to, you know, get sleep so you make it to work on time and you're refreshed. Maybe it's support in you having to have a discussion or a chat with someone so you can get something off your chest. You know, if you think about it, everyone, and I know you're not supposed to say everyone or never or those kind of words, but I will say everyone needs support to go to work. And it doesn't look really that different if you have a mental challenge or not.
Under the new system, Liz, what's the first step a person or family does to get help if self-medicating or substance abuse, studies show, are usually linked with mental illness, is an issue?
You are correct that there is a high rate of individuals who self-medicate because of their mental challenges. That is true. And by self-medicating, depending on how long you've had that history, you definitely could be someone who deals with the substance abuse disorders or challenges. In order to get assistance, it's no different than it has always been, and that is you contact the Regional Behavioral Health Authority, which right now it's Mercy Maricopa. They have a customer service line that you can contact them, and they will direct you where to go get an assessment.
What training are the doctors, medical, and administrative staff getting under the new integrated system, and does it include longer consumer and doctor-counselor visiting times?
Well, I can only speak for Recovery Innovations, and one of the things that we are doing is we are very committed to ensuring that the medical staff that will be joining us understand and believe in recovery philosophy and the recovery model. People tend to use different words. That is something that's very important to us. Recovery Innovations has made that very, very important across the agency, CEO on down, and it's not going to be any different when we start hiring doctors and nurses for the integrated health. You can learn recovery, you can teach that, but you can't teach the belief.
Is there anything you'd like to share about that long and drawn out 1981 Arnold versus Sarn lawsuit?
Oh, well, I can tell you one thing. I am so glad it's over. But I do need to say, again, there might be a slight misunderstanding. While it has been settled, I think we need to be concerned. The whole community needs to be concerned that if what was stated in the settlement is not followed through, it will be back. And rightly so, because a lot of people made commitments in order to settle that lawsuit. I'm very thrilled from some of the components. You know, I'm an administrator today, but I'm also a clinician. I'm a licensed professional counselor, and I am thrilled, beyond thrilled, that part of the settlement is we are required, we being Maricopa County, are required to provide some evidence-based practices. And what that means is when we implement services, for instance, in supportive housing, in supportive employment, in consumer-run agencies, it's not enough to just say we're doing our best. But there actually is going to be a fidelity tool that is going to be applied on those services. And so someone's going to come in from the state agency. I think of it as a report card. They're going to come in and they're going to check if those services are being applied and carried out within that evidence-based practices. I am thrilled that if they're not, you might not be providing those services. So it's a high incentive to provide services within the evidence-based model.
Liz, what are you grateful for today?
I am grateful that I am living my life today the best that I can while managing and living with my challenges.